Gerry Pezzano is the president and CEO of LeadingAge PA. Now, last year, a joint state government commission looking at Pennsylvania's aging population reported that the state's population of adults age 85 and older is expected to nearly double by 2030. What impact would that have on Pennsylvania?
The impact it has would be a strain on a system that's pretty fragile now. And I would say that's the biggest concern we have moving ahead. And to be very specific about it, it has to do with access to care and access to services that older Pennsylvanians want, need, deserve. That's really what it comes down to. That's the challenge.
Now, you said the system is fragile. Why?
Well, the system is fragile in the sense that for a number of reasons. One is, if you look at the long-term care system in the state and really across the country, it's been historically underfunded. So there's a catch-up that needs to be done. So you imagine, even though, in the recent past, we had gotten Medicaid increase for skilled nursing facilities. That was a huge help, a huge win. When you're looking at historic underfunding, you're talking about systems and processes and physical plants that have not really kept up with the times. For instance, we have long-term care. I say often is the land that time has forgotten. There are so many exciting and useful and effective ways to provide care and population health measures, telehealth, technology, all of those things, they require investment. So it's an industry that's playing catch up.
What are some of the sources of funding for the industry between state, federal, and other sources?
Okay, well, we focus in on Medicaid beneficiaries. Then there is the federal Medicare funding, and there are state supports, around affordable housing and different programs that serve older adults. And at LeadingAge PA, we have about 430 members, and they represent really the entire ecosystem of aging services. So our members are those who are owning and operating life plan communities, continuous retirement communities within their portfolio. They will have maybe hospice, home health, home care. Our members are from the affordable housing sector, personal care. So it enables us to do something very unique as a trade association, and that is focus on the person. So it's not so much the setting, but it's envisioning what kind of care and what kind of services can the individual access, regardless of where they are in the ecosystem.
Now, you mentioned access to services and care as a significant figure. What are some of the big obstacles to access?
Well, I would say that we talk about a workforce crisis, and I certainly want to speak to that because it's real. There's also the underfunding that we speak of. There's also there's not the flexibility in the system to ensure that the resident is going to be able to access the care just in time, the type of care that they need. So why don't we start with workforce? Okay, historically, long-term care has we've talked about not having enough workforce and working through workforce shortages. So you layer on top of that the pandemic, and the pandemic effect was that there were a number of healthcare workers that just left the profession. They left at that point. And there are those who, stayed within, and it's a rough job. And it was even rougher during the pandemic. So, you had, dealing with burnout to a certain extent. We also have the aging of healthcare workers in long-term care, and not necessarily, replacing those folks quick enough. I would say that, when you look at workforce as a whole, it's impacting our providers' ability to, provide care to as many residents as they would otherwise. Give you an example. So for our skilled nursing facilities, our nursing homes, we in 2022, we had gotten Medicaid funding that was tied to certain staffing ratios, staffing requirements. If you can't meet those requirements, what are your choices? If you don't have enough staff, then you're looking for agency staff. That agency staff, the pricing of that goes unchecked, so it becomes an affordability issue. And if you can't staff, then you really have to lower your census. You have to limit the number of residents that you could service. So, that's what we see happening out there. And the effect of all of this has been that, beds have been taken offline. The hospitals are looking to, transfer patients to nursing homes, and those beds aren't available. And, the impact being, it becomes an access issue. We surveyed our members, and I would say over 50% have limited the number of beds that they have available. And, the problem seems to be increasing, because 6 months before, it was 34% of them told us that they were limiting the number of beds they had available in nursing homes. So that's increasing. 86% of them are telling us, in order to meet staffing requirements and just have enough staff to safely care for residents, 86% of them are utilizing agency staff. And there's a good portion of them that are telling us that the agencies don't even have enough staff for them. So I refer to this ecosystem, right? And we also have to look upstream. So what's happening in the hospitals? I will tell you that we're looking at data that tells us that the average length of stay for our hospitals in Pennsylvania has increased on average by 2 days. And that's significant. It's significant for a lot of reasons. First of all, it tells you that we know specifically that the issue is that these residents required skilled nursing care, and there's not a bed in a nursing home for them. So they're being held up in the hospital longer. So from a system standpoint, it's much more costly to care for a resident in an acute care hospital than it is in a nursing home. The other big reason is the acute care hospital is not the place for an older adult to rehabilitate. There's lots of reasons why. Their movement is restricted. The level of stimulation they're getting is restricted. The environment is not intended for living. It's intended for acute purposes. So you've got residents who are not in the most appropriate setting, and it's costing the system more money. And the longer an older adult is not able to, get the kind of stimulation and the movement that they need, it really is an imposed dependence. So it's harder to rehabilitate, once you've been in that situation. I was reading recently from the Bureau of Labor, reading an analysis that the staffing situation in hospitals at large is improving slightly, and that's for all the caregiver positions. And in physicians' offices, even a little better. So there does seem to be a rebound. there's also statistics out there that they're sharing that it really is about pay, and that it's it really is above inflation. So we're finding that there is a limited number of healthcare workers available. They are following the money, as you would expect. It's a necessity, and that's why I refer to this as an ecosystem. What's happening in the hospitals and the physicians' offices impacts every other setting.
Let's talk a little bit more about workforce. Are there programs in place that can recruit new people into the field?
There's plenty of activity going on. We really need to start with the context of that the older population is outpacing the workforce population. So, we've seen this coming toward us. So there simply, are not enough, in this current system, and, the exponential growth of the older population, and, the fact that it's outpacing the workforce population, there is a shortage, right? So we have to state that. In regard to, if we look at this in regard to what needs to be done immediately and what is being done immediately, and then what needs to be done incrementally and then beyond. Immediately, we are seeing lots of good work going on in regard to what's happening through the long-term care Office of Transformation. That was developed through the RISE program, and looking to improve the work in skilled nursing facilities, in nursing homes, in regard to infection control, in regard to support for workforce, improving conditions. Lots of good work going on out there in regard to even the work that we're doing. We've got a campaign that we run, Careers to Love, and it's to help folks understand that there are viable, very satisfying careers in aging services. You just may not know them as options for yourself. And when we talk about, careers in aging services, we'll immediately think of caregivers, right? Direct care workforce. There's plenty of other opportunities. I've been at this for about 40 years. You won't believe the people I meet and I talk to about, how you've got involved in aging services.
Talk a little bit about some of the programs that you're interested in and you would like to see move forward.
Phil, one that comes to mind is the LIFE program, Living Independently for the Elderly. That program is intended for residents who required skilled nursing care. They still own their home. They want to stay in their home, and they may be eligible for this program, whereas they reside at home, and the LIFE program provides transportation for them. They come to a LIFE center where they receive, their medical care, their rehabilitation therapy, meals, their activities. It's an alternative to the nursing home, and that's part of the solution. If the number of nursing home beds is shrinking, if the availability of the nursing home is being limited, what are our other options? LIFE program is a viable option for many people. By and large, people are going to tell you they want to stay in their home. We need to do a better job with the LIFE program. I am hard-pressed to find anyone when I'm on the Hill that doesn't believe in the LIFE program and see it as a viable option. But again, it's underfunded. They have not received an increase in, say, the past decade. And their costs, are outpacing their ability to care for these residents. And it's the same challenges in every other part of the healthcare system. It's about being able to pay wages, to attract staff, to run programs, to maintain the physical plant. It's the same story in every setting, but we really need to do a better job for life because, I mean, people want to stay in their home.
Now, earlier this month, Governor Josh Shapiro delivered his budget address. What did you hear in that address that you liked?
A lot. We're very encouraged by Governor Shapiro's attention to aging services. So a couple things that stood out to me was the investment in Aging Our Way, or the master plan for Pennsylvania. That was just published, and we're reading through that, and it addresses the needs of older Pennsylvanians. Very positive. Funding for the office that I already mentioned, Long-Term Care Office of Transformation. More funding for that. Looking forward to a meeting with that group. We work very closely with them, and to have a conversation about how that money is spent. There have been some tax breaks. The education dollars is only going to help to build workforce. There was also monies for housing, an emergency housing situation. So I think there's lots of positive things there, and we are in the midst of, the budget advocacy process over the next couple months. That was the governor's address, and that's preliminary. Now is our opportunity to continue in full force to make the needs of older Pennsylvanians known. What's not in there that needs to be in there is for nursing homes, an additional, I would say, $70 million. And how we come to that is it's about meeting the staffing ratios. In order to meet them, we have to attract more people to workers to nursing homes. You can see from the hospital example that the slight increases they're getting are about being able to pay higher wages. And then there's also the cost of care. My members would tell you that the cost of food continues to rise. There was another example for you is during the pandemic, COVID tests were paid for, by the state for the nursing homes. That's on the back of the providers now. So it's not only to be able to, afford staff. It's really to keep up with trying to care for people. And I will say this: it's important for us to remember the dollars that we had gotten in 2022, the 33 million annualized we got last year, and the money we asked for this year. All of that money comes with accountability. So the stipulation is that 70% of the Medicaid spend must go to the bedside. So it's not like this money is not being used for the intended purposes. It is, and there's checks and balances around that. And then also, our budget ask has to do with the life programs that I spoke to. We're asking for a 5% increase, which would equate to about $9 million, and also a cost of living increase to not only help these programs grow, maintain, and continue to serve residents, but to grow. We have greater opportunities in Pennsylvania to take care of a program like that.
Are Medicaid reimbursement rates keeping up with the costs that you're talking about?
No. And that's the issue at hand. That we're playing catch up here, and that's exactly what we're asking for. We're asking for increase to Medicaid rates for nursing homes and Medicaid rates for life programs. Yes, it is all about Medicaid at the state level.
So when you're talking to legislators, what are you hearing from them as you're expressing your concerns?
We're hearing a real sensitivity to the fact that everybody gets it, that Pennsylvania And I apologize for using two different numbers here, but I've been reading and I've got two statistics in my head, and that's that we are the fifth oldest state in the nation, and then one source told me we were the ninth. But it has to do with the number of older adults that we have in the state. So we're up there, right? So everybody gets that the older population is growing, and that there's something that we need to do about it. The legislators are very sensitive to the fact that there is a workforce crisis, and that aging services is probably hit the hardest. One of the things that we really pride ourselves on at LeadingAge PA is our approach to advocacy, and that is not just to go to the Hill and ask for money. It's a more comprehensive, robust, and practical approach to it, in that it starts with honoring older people and celebrating older people. And we do that first and foremost. So, one of the things that we had this year was we had a gala at our corporate office. We collected art from residents in our member communities, about, I think, maybe 150 pieces. And the was a juried show, and 50 pieces were selected that we exhibited at the gala. So one afternoon while we're having this gala, the vans start pulling up to my office with residents, all dressed, for this event, and we got to celebrate them. And we had we had Chair Patty Kim there, and she made some really poignant comments, and it was about recognizing older adults and celebrating them and recognizing that they have needs. We are also collecting their stories and the stories of our providers. I can go on the Hill and I could talk about what the problem is, but it really rings in a different way. It resonates very differently when the providers get to tell the story about the work they're doing, trying to care for residents and needing the funds for it. So that gala I talked about, we are going to do a lobby day. We're going to be at the Capitol, and with the art gala, press conference, and then we'll have members and residents make legislative visits to tell their story. And when we are making these legislative visits, we are creating partnerships. So we talk about the immediate needs. The immediate needs are about funding and workforce, but they're also incremental improvements that we need to make. So what we did at LeadingAge PA is we formed what we call LTSS Evolve. So when providers, during the course of the day, and I've been a provider, I'm a clinical operator by background, and we walk around saying, this policy is antiquated, this regulation is cumbersome, this practice doesn't make sense anymore, it stands in the way of us spending more time with residents. Well, what we're doing with all that information is we're working with our members, we're collecting it, and we're being strategic about finding some legislative partners to champion that. And we had a great success first year out. So we have these staffing ratios that are mandated that I told you about, and DOH surveyors were out there and they were interpreting the ratios correctly, but very strictly. And what we did was we asked for some common sense flexibility. Simple thing like, instead of rounding up on staff hours, calculate actual hours. So now, when a provider is taking advantage of a few hours of overtime from staff or partial shifts, all of that counts now. And it saves money, but it also saves us with accessibility. Now you're able to really serve more patients that way. That's something that came directly out of LTSS Evolve, and we've got plenty more planned.
Well, we've been speaking with Gerry Pezzano. He is the president and CEO of LeadingAge PA. Thanks for joining us.